Really?
We are
Wow.
live.
Huh.
But they were, I liked them. They,
Little interaction.
question and answers, man, they lied. But I'm not.
Yeah,
I mean, this is their moment.
no worries.
Interaction, huh? We need to be interactive with the public.
Good afternoon, Dr. Fletcher.
We're going to get started for today's presentation. But I'm going to do microphone on this side, here front row. Microphone on this side. Make sure we're talking into microphones for recording, and that way we can circulate it through. They are going to take questions. All right, it is 1 o'clock. We are here for a presentation from Panhandle Health District. With that, we're going to turn it over to Eric. All three Bonner County Commissioners are present. So, Mr. Kettner.
Thank you, Commissioners. I appreciate you giving us the time this afternoon to speak to you as well as to the community. The goal of this meeting for us is that we do have a strategic planning meeting coming up in May, and we're seeking input from the community on the role of the health district and frankly, how we can better serve the community in the 5 northern counties. This morning, I have a very brief presentation where I'm simply going to touch on the hierarchy, the structure of the health district, why we came into being, and touch on the services that we do currently provide to the community. A little background about myself, if it's pertinent. I've been with the health district for about 23 years. Most of my experience is in the environmental health programs. So I'll do my best to answer questions as they come up in regards to other programs, but you might have to bear with me just a bit. I did grow up in Boundary County. I've worked in all 5 counties professionally. I have gotten to know the communities to some extent. And I feel like I generally have a good idea for North Idaho. I understand that, generally speaking, we're not fans of government intervention or a lot of government intrusion into our lives. And I grew up with that mindset. But what I'd like to share is that I have found value in certain roles of government. And frankly, I found it to be appropriate for government to have a certain role when it comes to protecting all of our individual rights. So with that, I'm going to go into a very brief presentation. A few things that I want to touch on today that might be very, very hard to read is I just want to talk about the structure of the health districts. I want the focus to be that the health district creation was about local control. I want to talk a little bit about the funding that the health districts receive, and then go into the programs that we have, and then talk briefly about what future opportunities may exist for the community and for the health district. So the health district derives its legal authority from Title 39, Chapter 4 of the Idaho statutes which creates the health districts. In 1907, the legislature authorized the creation of the Idaho Department of Health and Welfare, and also allowed for the creations of each county to develop its own health district. By the late 1960s, only 23 of the 44 counties in Idaho had a health district. What that meant was that you had various access to various programs throughout the state. It was inconsistent and it was poorly developed. And where that's important is health district or public health differs from health care in that the goal of public health is to prevent disease and to prevent problems, to protect the environment, to do those things before the problem occurs. The current structure of the health districts in Idaho is we make up Health District 1, which is Bonner, Boundary, Kootenai, Benawon, Shoshone counties. And as you can see, there's 7 health districts, and this is the general structure. Again, back to the decentralized idea of public health districts. It was recognized in 1971 that having Boise or having directives come out of Boise to the entire state was not an appropriate approach. As a matter of fact, it was recognized that there's a lot of differences in different regions of the state. And the goal of the health districts was that up here, we address the health issues and the public health issues in a manner that we see fit. And that speaks to the structure of the health district, which I'll touch on here in a second. So organizationally, the top of the pyramid is the county commissioners. So my boss, our Board of Health, their boss is the county commissioners. The county commissioners, they appoint a Board of Health member that is then voted on by all 15 county commissioners of the 5 northern counties. And then with a majority of votes, confirm that individual, then they sit on the Board of Health. We have 7 members on the Board of Health, 5 representing each county, and then we have 2 at-large positions, 1 representing Kootenai County and 1 representing Bonner County. Below that, below the county commissioners, we have the Board of Health, which is the 7 members. The district director, that's my position. And then the individual programs fall below that. So essentially, the county commissioners decide who's on the board. The board provides overall direction for program implementation. My job is to take those programs and follow the direction of the board and implement those, hire, fire staff, retain positions, that sort of thing. Funding wise, the health district gets 47% of its fees from contracts and grants, 6% from interest-bearing accounts, 26% from fees, and then 21% of it comes from the counties themselves, the 5 northern counties. There is an equation that's put into place that determines how that 21% is spread about. It's based on assessed property values and population. We offer 40 services to all of the communities. And I think, again, this speaks to why health districts were created in the first place, is that there are some counties that are smaller, some are larger, but by consolidating into districts, we're able to provide all of these 40 services to all of the counties, including those that likely would not have the resources to be able to implement those themselves. So here's some numbers of individuals that we do reach in each of the counties. Obviously, we're in Bonner County today. It's around 4,000 folks that we either saw in our clinical settings that we issued permits for, whether those were food licenses, septic permits, that type of thing. And touching on my background a little bit from the environmental health standpoint, and then going to the value of having a health district, a regional health district, is that up here in the 5 northern counties, we have about 14% of the state's population. We have 9% of the state's surface area, but we have 33%. We have a third of the surface and groundwater in the state. And we issue about a quarter to a third of all of the septic permits. So again, from my background, if our goal is prevention and septic permitting is all about putting wastewater in a location that it's not going to affect either your groundwater or surface water or your neighbor's groundwater or surface water, this is a very important and critical issue to our area. Other programs that we have, we do have nursing services. We do the disease investigation. We do offer services, either low cost or free services associated with sexually transmitted infections and other services. Public health preparedness, epidemiology. We do a lot with health education, providing resources as far as senior companions to individuals within our community. And I guess on my final slide here, I'd like to touch on the fact of we're seeking input from the community. I've touched on very briefly the services that we do provide, but I'm not sure how many people here today are here. I hate to bring it up, but are here due to COVID or due to the masking, but I'm simply going to bring it up because what I would like to touch on is the fact that generally speaking, public health is silent. The work is going on. Nobody notices that we're there or that the work is being done. And that brought that shone a light on one aspect of what the health district does. I'm not saying it's insignificant by any means, but what I am saying is that we do a whole lot for the communities that we serve. We're here to serve the communities. We're here to work for you. We're here to work for the commissioners. And we're looking for direction and assistance in how we can do that better. So with that, a few ideas that I've put up on future opportunities is in regard to environmental services. How can we better integrate with the counties? How can we provide better service and better planning services to individuals that are looking to develop property? Nutrition services. How can we help people lead healthier lives, make better decisions in the foods that they eat? In health promotions, how can we better educate the public at large on better ways to live their lives to prevent long-term disease or disability? Home visiting is another issue that's come up that's fairly significant. Health and welfare is focusing heavily on foster care in Idaho, and the home visiting allows resources to new mothers to help children stay within their homes, even if those are difficult home environments. And then again, with opioid settlement funds, there's a lot of needs in the community and how we can use those funds and how we can help the community. So those are a few areas that we're looking to develop. But again, we're here today to ask you, what can we do? What ideas do you have? How can we move forward? That's all I have. Any questions for me?
So I put microphones on each side, so after his presentation, if you guys have a question, raise your hand, we'll pass that microphone. No questions. What? From Bonner, you got the microphone, sir, right next to you.
Well, what I want to say is first of all, thank you so much. What I want to say is a change of subject from what we just spoke about. It's not radically different, but it's weighing heavily on my mind. And I know it's on the mind of a lot of people in this room. Can I jump in with a different topic?
Let me clarify one before I say yes or no. Is there another presenter that's going to present another topic that might be in the wheelhouse of why Bonner County comes out here? Because we want to know about COVID, masking, and all these bird flus that are coming out and what the position of Panhandle Health is, but also implementation. Is there another conversation here, or can we shift it?
It may be beneficial to wait till the entire presentation is complete. I believe our chairman has some words to speak in regards to public health.
Is your question moving
I feel
towards public
comfortable
health?
with that.
Okay.
I want you guys to be in your flow.
So let's say questions on what he presented. So there's a gentleman tapping behind you. Thank you.
Is somebody in front of me over here?
Nope, it's all you there,
Could
sir.
we flip back to the previous page? Slide. And I'm asking a couple of questions here with no agenda. Simply clarification. What is it that qualifies your staff to go into homes? It's a pretty touchy thing. How are you qualified? How are you related to Child Protective Services? Substance use disorder. There's some really important things that you do there. Do your people have medical backgrounds?
Yes, in the home visiting, it's a nurse family partnership. And I need to emphasize, these are voluntary programs. These are not the health district imposing themselves into individuals' homes. If you want to participate in the program, you apply to have a nurse enter your home and to provide some of that guidance.
So you're not Child Protective
No.
Services?
No.
Okay.
We are not.
Can I ask you to expand on the questions that I hear on that is, does this allow for the door to be open to something like that? Because we have a very conscious community that has concerns about opening the door, even if there's a need there. So if there is a need, but then the nurse has concerns regarding what they see in the home, does that open the door? Because that might make somebody limit their desire.
And my understanding is that the nurses, they are mandatory reporters. So if they do see something that's occurring that meets the criteria of abuse, they do have an obligation to report that.
I'm gonna push you a little on that because mandatory reporter, I accept that one. I mean, I have a concern about the way this family is parenting their child is not necessarily abuse. It can be a difference. And so is there a gateway between information that's taken in this setting of home visiting that can be transmitted to this is a family of concern? Like, for example, when you're at the hospital level and you get that drug test on your newborn, you've opened the door to see PS, regardless of that finding, that can kind of have that snowball effect. And I know that's always a concern in Bonner County community is home visiting sounds great for the intended purpose, but is it a gateway to something bigger? Am I hitting on what some people have? Okay.
And I would say that from what I've seen, granted, I've been in this position for about 6 months. The only time that I've seen involvement is when there's clear evidence of abuse of a child. It's not a matter of we think that their parenting is wrong, right, or we don't agree with it. It takes a pretty significant event for a nurse to make a report.
Okay, thank you. Right next to you there.
I have noticed what you said about the Panhandle Health operating largely unnoticed until there's some sort of a crisis or event is true. And oftentimes there's not a lot of gratitude for the good labor that you do. However, one thing that I'd like to see, and I'm not sure that it's structured this way or if it's just presented this way, but very often when we do cross paths, it comes across more as you representing the government or the CDC or the WHO to us rather than representing us to them. And I would like to see protecting and defending us to an overbearing or overtaxing or disagreeing entity rather than pushing stuff onto us that we don't believe is accurate or correct or helpful.
And I think, that's where it becomes very important to have an engaged Board of Health. Because as you can see from the hierarchy, I do not operate autonomously, and I work on behalf of the board. If the board believes that what's happening with the district is being done appropriately and I'm driving that, then they can choose to not employ me as the director of the health district. When we do have significant events that are occurring, it fully comes down to the 7-member board to decide how the health district is going to move forward. If the CDC or if other agencies say this is what we believe is appropriate, the board does have some level of discretion on how to move forward with that and what level of involvement the health district is going to have and how voluntary or involuntary that's going to be.
So could I just request that the people that are asking questions, if you could please just state your name for us, please?
Kristen Dodd, for the record. My question is, how often do you exercise these services in our county, or maybe across the 5 counties? Is there a great need versus maybe not so much?
And that's a good question. Frankly, that's something that's evaluated on a regular basis. A lot of times something can seem like a good idea. There can be funding available for it, and we move it forward and we find out that the need or the interest level or the participation is not as good as we expected. And frankly, then we will close out that program and we will no longer accept the funding and we'll look for other ways. To share, one of the things that we do on every 5 years is we do what's called a community health assessment, where we do reach out, to community physicians, to community partners, to long-term care facilities, various other entities to try to assess what are the needs of our community and where should we be seeking funding and where should we be pushing forward efforts. So we're not just blindly looking for the best way to go. We do have some general guiding principles that we are receiving from the community and how we move forward. But just because it seems like a good idea and we expect it to be successful does not always mean the participation is going to be there.
Can I ask you to expand specifically on, say, nutritional services? What does that look like? Somebody looking to have those services performed?
Most of that, I guess, is sort of a broad term or another term for the Women, Infants, and Children's Program. So again, that's a federal program. I believe it's income contingent that allows for mothers to bring their children in. Again, it's a voluntary program, and they can get stipends for foodstuffs and get guidance on nutritional or best nutritional practices.
So you're sort of like a liaison between
Yeah.
the federal program and the community member.
In that case, yes, yes. ma'am.
Okay, thank you.
Back to you, Jane. You still have the microphone.
Jane Purdy for the record. What is the Panhandle Health's involvement in restaurant regulation, cleanliness, cottage food industries? What is your role and what is your level of control in those areas?
That is the state of Idaho has the Idaho Food Code, the food safety rules. It's based on the FDA model food code. That's something that Health and Welfare, it's a rule set Health and Welfare promulgates. And then they contract with the health districts, the 7 health districts, to implement those. So other than the same level of public comment that any individual would have during the rule promulgation, we don't have, it is their rule set that they hand off to us. That being said, and I can certainly speak from experience, when we're where the rubber meets the road. So our inspectors that are that are working with food establishment owners, cottage food individuals, we want them to be successful. We live in these communities, but there are certain things that the food code allows you to do, certain things that it doesn't allow you to do. And in other cases, there's a gray area. And so we do work, I would say, as advocates for local vendors with the state food program. We have been part of they have guidance documents that they come out periodically to address those gaps. And when we see areas where we believe that it's in the best interest of the public and that it's safe for the public, we will advocate, for greater leniency. Some areas it is an absolute public health threat, and that there has to be those controls in place. So again, not our rules. We do have authority to implement them. We do try to take an even-handed approach to how we implement them. But yeah, we live it with the business owners.
Any other questions?
Hi, I'm Jenna Anderson here. I'm curious whether Panhandle Health works at all with like the EPA or other environmental protection organizations in regards to like pollutants that come into our counties here in the Panhandle, and how we deal with those and how we mitigate pollution.
We, other than our work in the Bunker Hill Superfund site, we don't have direct involvement with the EPA. But it's more indirect, because in many cases, there's a lot of environmental protection, a lot of environmental rules that start at the federal level. And then the states have an option to either take primacy where they develop their own rules, or the federal government will impose, will take over enforcement of those rules within the state. So what you end up having is the state of Idaho takes primacy of solid waste rules, of subsurface sewage disposal rules, a variety of rule sets. And then those usually are held by DEQ, but in many cases, those are delegated to the health districts or contracted to the health districts for implementation as well. So we don't have conversations directly with the EPA, but we essentially are an arm, I guess you would say. And again, this speaks to local control. Instead of having somebody out of Washington, DC or the Seattle area dictating how things are occurring, this is going, the state wants control of that. And by extension, they want it to even have more local control by being handed to the health districts.
Okay. So I guess that leads me to the question of like, if residents here in Bonner County, Boundary County, and the Panhandle have concerns about air quality and things that might affect our air quality here, like it becomes this really blurry thing, because obviously the air is shared across our planet and it doesn't stop at the, boundary lines between counties or between states. So, what I'm hearing is there's a lot of things that kind of come top down from the federal level. And I think many of us feel like they're not really keeping up with the times. Maybe they're not happening at the pace we would like to see them happening at the federal or the state level. And so that leaves us hoping that maybe our local counties will be able to, again, help act as a liaison or get our message across to those state legislators and federal legislators who, maybe aren't taking our concerns as seriously as we would like them to.
And there is some possibility with that. Idaho itself has generally taken a position to not be more restrictive than the federal government. So as a state, that is the position that they take. But the health district does have a history of when there is a local issue of addressing it head on. The example that comes to mind is the Rathdrum Prairie Aquifer, which was identified as being highly susceptible to pollution back in the early 70s, and the health district did promulgate its own rule set and protections into place to where, you know, that is one of the few aquifers that remain in the state where you can pull the water straight out of the ground and you can drink it, and it does not have contamination. So a short answer to your question is the health district does have that latitude if there's enough desire within the community to drive something like that forward.
That's all for now. Thank you.
Any other questions?
Thank you, Eric, for coming. I'm Dr. Byron Haney, and I am here asking the question, what is going to be done for immunizations for families who want their child immunized now that we no longer have the services here at the Public Health Department?
We are still providing those services. Are you talking from a staffing standpoint or?
Well, yeah, so when people have gone down here to get immunizations, they've been turned away because there's not a nurse here, as I understand.
Yeah, and we have been in a bit of a state of flux in bringing new staff on, but the plan is to continue with those services and to rehire positions to fill those roles.
And in my own question to you, in your own idea, how long is that going to be until it's implemented? Just off the cuff.
We have been actively attempting to hire, but what I can tell you is hiring medical professionals in this area, there is a lot of demand. As a public entity, it is very hard to be competitive in salary when we're up against Kootenai Health and various other entities that are paying a lot more than we're frankly able to even pay.
And I understand that. And so where my question comes next is that I thought I was coming here a year and a half ago to retire. And I find myself back in healthcare. And one of the questions I have for you, in the state of Washington, where I came from for my entire medical career, which is over 30 years, I had immunizations in my office that I was given those immunizations by the county. The county were getting them from the state of Washington. And we were just passing them on using our nurses to the patients. And we weren't charging, we weren't marking it up, anything like that. It was just a pass through, and they supervised us where the temperature's right, et cetera, et cetera. So is that an option that we could reinstitute here now?
That is, as I mentioned at the beginning, that is an area where I don't have a lot of depth. I know we have some nurses actually here in the audience that could probably effectively answer this question. But that being said, as I know that we do get some discounted pricing, I would have to look into it to find out what our costs are on certain immunizations and if it would be possible to pass that through to.
So I'm just here to say that my office would be willing to carry those immunizations in our office and give them to our patients without a markup cost at all, just pass through if we had them given to us by the state. I have the knowledge, I have a history of doing it, and I'm willing to do it. The only other thing I have is that was why I came. I didn't see all this future opportunities. But if you look at that list, really what's behind all of that is something called the triple aim, where you decrease the cost of healthcare, increase the quality, and increase the patient's experience. And there's a few things that I see on that list that I have some thoughts for you. Like health promotion, the number one most expensive cost disease in America today is diabetes. I went 11 years without anybody converting from prediabetes to diabetes. If you take those people in a group setting and let them take care of themselves and empower themselves rather than a doctor being paternalistic, I'm willing to pass on to my community information and knowledge that I have.
Yeah, and we do have what I'll call a fledgling diabetes program where we do have it's set up to meeting, I think similar to what you're speaking to, but we haven't seen a tremendous amount of participation as of yet. Again, they're newer programs, but I would certainly welcome your thoughts on how we can move that forward.
Partly, I think the reason you're saying that is how it's been done in times past is the CDC has used a study out of 2001 that was published in New England Journal of Medicine of the lifestyle change issue. People may or may not get into that kind of a program. The programs that have been most successful, and that what I did myself, was actually have a physician in the room treating the patient and empowering them to take care of themselves. And the outcomes are phenomenal. I published on it. And I think that's the key, that the CDC had a health educator rather than a provider of health care.
Yeah, I'd welcome meeting up after I'm done and getting your contact information and any information you can share.
So my name is Carrie Ann Yarnell, and I just wanted to address the question about the vaccines. So Panhandle Health they get their vaccines through the Vaccines for Children program. And so that is money where, yes, they do get it discounted price, and that does get handed down to the families because there's zero charge for any children getting vaccines that are residents of the state of Idaho. They also liaison with Washington. So if they're also a resident of Washington, that is also applied. If they're like from Montana or other states, as long as they meet the VFC requirements, which would be Medicaid, Native American, Alaskan Native, underinsured, and if they're under 18 or under 19 years of age. So if they meet any of that criteria, they qualify for free vaccines. The only charge that happens is an admin fee, and that's set at a max of $20. And my understanding from, the history of when we've been with Panhandle Health is that you charge up to 3 shots. So the max out for a child to get 3 shots would be $60, but that's never where you are. If you can't pay it, Panhandle Health has never forced that or put you into collections or anything like that. And actually federally that came out as well, that you only had a 90-day billing cycle. And then after that, you could not ever send another bill or anything to say that they owed money, and it could not impact future clinical services. So.
Back to you.
From my office, I'm a direct primary care clinic. And so our patients are paying, like for children, $25 a month for 100% care. Everything I can do as a physician. And our nursing charge for vaccination administration is $0. It's come. I know we don't do vaccines because we don't have them, but if we have them, it would be $0. It'd be no charge at all. It would go with their membership.
So what I'm hearing is that he's going to connect up with Panhandle Health, and we're going to have an understanding on what can we do to increase the availability of immunizations throughout providers that are willing to administer them in office. All right. Any other questions before we move on to the next presenter? None? All right. I actually got to put you on a question because I think this is what our community is going to want. In terms of future opportunities, what future do we see for people like this to be able to be in front of Panhandle Health to give our thoughts and ideas and hear what's happening as we move forward? And if that's your board meetings, when are those board meetings and what is the participation from the community? Is there a Zoom link before you get off?
Yes, we do meet the 3rd Thursday of every month. There is a public comment period, but I would also say this is a fair showing of individuals. I'm more than happy to make myself available to come before you and answer questions that may come up. And we do have a Zoom link, and I can share that.
And then if you share that with us, then we can put it on our county website for ease of access for Bonner County residents to see when those meetings are so that we can be informed and participate. Any more questions? Because I hear whispering. All right, we'll move on to the next part.
Okay.
Thank you.
Thank you.
Is this mobile?
It is.
Oh, wonderful. I like to walk. I'm Thomas Fletcher. I'm the chairman of the board of Panhandle Health.
Can I make you say one more thing though? This is Dr. Fletcher and he represents Bonner County on this
Oh,
board.
okay,
So we
fair
want to
enough.
make sure people know. So when you see him at the grocery store, you can ask him questions.
Fair enough. You can, you know, I practiced medicine for 40 years. I gave patients my home phone number. They could contact me. My patients did not have to go through a secretary or a nurse. They could contact me directly. You are welcome to call me anytime. One other thing to say about my years in medicine, I was never sued, not once. I think we're at a crossroads in healthcare delivery in this country. I think everybody has experienced in some measure shock from the last 5 years. I have a confession to make. You know, I'm a Christian, and as such, I believe in the concept of redemption. But Christ will not redeem you unless you feel contrition. So I'm here to tell you right now, I feel profound shame for my tribesmen. We lied to you. And so it's time we make it up. It's time we start telling the truth. So in addition to potentially a sea change in healthcare delivery in this country with Robert Kennedy Jr., you also have complete new leadership at Panhandle Health. You have a new chairman, a new director, new legal services, and shortly you're going to have a new bylaws. And bylaws changes, and Jessica may actually have me sign them, that will have a direct impact on the performance of Panhandle Health as it relates to how we interface with you. Now, the reason for this town hall meeting is to hear from you. I want everyone in this room to feel like they have a voice. And to follow up on what Commissioner Williams said, on May 10th of this year, we will be hosting a strategic planning meeting. It's in the conference room of the Kootenai County Building, ground floor, and you're all invited. It's a public meeting. So if you want the ultimate input into the future direction of public health in this county, in this region, then come to that meeting. In the meantime, you're also welcome to come to any of our board meetings. And in addition, you are welcome to call me personally. Now, before I open it up for questions, I'd like to make a few comments as it relates to a way in which to think about the changes we're looking at in public health. All right. If you go back and look at the history of human civilization, city-states arose in Mesopotamia roughly 10,000 years ago. For the first 5,000 to 8,000 of those 10,000 years, there was absolutely no concept whatsoever of public health. In effect, people defecated in public. They threw their trash wherever. People congregated into a city of sorts of 20,000 people, 100,000 people. Damascus, for instance, that was recently overtaken by some Salafist Sunni tribesmen, is the oldest continuously inhabited city on the planet, 11,000 years. But really, it's only been in the last 2,000 to 3,000 years that the concept of public health came into existence. In the Bronze Age, we find the development of clay pipes and latrines, and the city dwellers had some notion that you have to manage your poop. A couple of thousand years later, in classical Greek times, the father of medicine, Hippocrates, wrote a treatise titled Air, Water, and Human Health. He understood that how you treat your air, how you treat your water, your soil, directly impacts on human health. The Romans perfected it even greater, to a greater extent. Rome, classical Rome, had a whole system of sewers and stormwater management. And they collected all of that material, waste material, in the Cloaca Maximus, if you've ever seen it, it's the end of the sewer system. But where did all that material in classical Greece and Rome go? Well, it went into the nearby river. Their system of management was get it out of the house, get it off the street, put it into a clay pipe, and send it to the nearby river. Well, think, our local rivers. That would be a sad thing. Well, after the fall of Rome and you have the Dark Ages, actually public health went into complete disarray, and we had a series of plagues, and health of urban populations went into decline. The Black Plague in the 13th century, 3/4 of the European population died. We lived much shorter lives prior to the modern era. And in fact, infant mortality or childhood mortality, 9 out of 10 children would die by the age of 5. Why? Bad health, diseases of one sort or another. Along comes the 20th century, and profound changes were occurring in the administration of public health and the knowledge and the science of public health. And I have only one slide. Is it up?
I think arrow key, right arrow.
There we go. So what you're looking at is childhood mortality from 1750 all the way up to the current era in different countries of the world. And in the developed countries, you'll see that death rates were high and they dropped. And the big change occurred right here, first half of the 20th century. And we've been down in here for the last 75 years. So huge gains were made. How were those gains made? Management of our waste, water treatment. So the Romans collected all their poop and they just dumped it in the Tigris River. Well, we collected our poop and we actually composted it. We dealt with it and then turned that liquid loose. So there was an escalation in the way in which we managed our poop. All right. One other event occurred in the 20th century, particularly starting around the mid 20th century. And it's, I want to now develop this notion of management of the commons and a differentiation between public health and private health. And a lot of your questions, I was listening to your questions. So I want you to go back and reflect on the questions you were asking in the context of this notion I'm going to develop as it relates to public health versus private health and management of the commons. These are the core concepts I want to develop with you as you think about how Panhandle Health should move forward. Here we go. About the middle of the 20th century, public health got involved in a portfolio of business of services beyond management of poop. Remember, for the previous 2,000 to 3,000 years, public health was managing poop, management of the commons. Now, what do I mean by commons? Common water, common air, common soil. That's management of the commons. We all own the air, the water, and the soil. We cannot differentiate that. Now, I'm not going to get into the nuances of private property rights, but I think at an intuitive level, all of us can understand that if you dump a bunch of shit on your property and it flows down to your neighbor's land, that's not right. I think even the most ardent private property fanatics can agree that there is some management of the commons. All right. But mid-20th century, public health expanded their portfolio of business. Now, what do I mean by this? Well, there were a couple of significant personalities. Margaret Sanger is one of them. She was a human being who got involved in reproduction. Upton Sinclair was another one who got involved in management of what you eat and the development of the USDA. So now, mid-20th century, we find that in the name of public health, the government is now managing what you eat and your reproduction. Well, now, let's now employ the term, this notion I introduced a moment ago, public health versus private health. Now, I'm not going to preach to you what public health ought to be, but I do want you to at least ponder the question, where is the demarcation between your health as it relates to you, your bodily sovereignty, who you are, versus health as it relates to our collective? And here we get into it again, this notion of management of the commons. I would submit to you on a common sense level, sort of common morality, common psychology, that public health should involve management of water and air and soil. The question for us collectively to now ponder is, should public health manage whether you breed or not, what you eat? Can you consume raw milk? You see where I'm going? There's a differentiation here between public health and private health. And a lot of your questions, I enjoyed every single one of your questions, but if you think about the root, the moral root of your question, you were really driving at, well, wait a second, that's my house, that's my body. What business does the government have in my private health? So take vaccines. I think we've got some vaccine protagonists in the group. Hallelujah. I'm happy for you. That's private health. You want a vaccine? The whole vaccine schedule, all 72 vaccines that an American child would get by the age of 5? Fine, do it. I'm not going to impede your private health. You see where I'm going? So I think we are at a crossroads in the management of healthcare in this country, both private healthcare as well as public healthcare. I am looking to our commissioners to give us guidance. Again, as Eric pointed out, the chain of command here, we do not take our command from the CDC. We do not take our command from the governor of Idaho. We take our command from these guys right here, all 15 of them. And then, so that's why we're going to have a strategic planning meeting, and we're going to hear what their input is. And we will try to execute as best we possibly can. Now, let me give some examples. Oh, one more comment I want to make before I open it up. A year ago, the Idaho legislature passed a bill on Medicaid expansion. And the citizens of Idaho who do not have the means to afford a private physician have now something on the order of $800 million to now secure their own private medical services. You do not need to go to a public clinic. Or for that matter, even the VA, although the VA has pretty generous services in its own right. But all you need is a Medicaid card, and you can pretty much a la carte get whatever medicine you want. I say that because as we move forward in defining what you want from Panhandle Health, do you want us to continue to function in the arena of those services that relate to private health? management of diabetes or prenatal care or, hypertension, sexually transmitted diseases, etc.? Or would you rather that the public health department focuses its efforts on the management of the commons, the classical domain of public health? Remember, all the portfolio of services having to do with private health were introduced in the mid-20th century. That was not the way it was in classical Greece or Rome. You follow what I'm saying? Okay, with those preliminary comments, I'm open to questions.
So let's go to. I was gonna go right here because I asked him to wait until Dr. Fletcher spoke and then we'll come to you. So do you have your microphone still, sir?
Check now. First of all, thank you, and you're amazing. We've spoken before. Yeah, I'm just gonna jump in with it, and I'll make it short. Oh, my name is Matt Loam. I'm working on the bridge on Cedar Street Bridge, and you know what I want to talk about because we had a brief conversation about this before. But this topic,
In fact, you've even called me.
I have, and he did answer in person. It was amazing. Anyway, it makes me a bit nervous to talk about the subject because it's so much bigger than us in this room. But if we come together, I believe there's a path forward. I want to personally contend that the low-hanging trails that we see crisscrossing our skies all the time, day in and day out in Sandpoint, are filled with dangerous toxic chemicals. I would call them chemtrails. I think they're less commonly referred to as stratospheric aerosol injections. We've all seen them. They fan out far and wide. They create a gray, ubiquitous haze that eventually blots out the rays of the sun. Personally, I contend that these chemicals fall to the ground. They land in our lakes, our rivers, our forests, our soils, our crops, on our animals, our insects, grasses, and flowers. I would say that this falls in the realm of public health versus private health.
Agreed.
I also contend that these chemicals are adverse to our public health, possibly to the point of trumping any other subject that comes up. You can avoid a vaccine if you don't want to take it. You can get a vaccine if you want to take it. How in the world are you going to avoid chemicals falling from the sky? Now, I understand that what I am talking about sounds nothing shy of mass poisoning. And somebody might say, Matt, you're getting a little hysterical here. I would say that is a fair assessment. It does not matter what I, Matt Loam, think is happening in our skies, but it does matter what this commission thinks, and it matters what Dr. Fletcher thinks, and it matters what your commission thinks is happening. What I wanted to talk about here is, rather than being alarmist over something that someone might say is imaginary, those are just contrails. That's a very natural side effect of a plane flying overhead. But I'm contending that it is something very different. So I would like to put on the committee that you guys are the ones that must bring this up and must decide what you think is going on in our skies. It's been a long time since I've seen a crystal clear blue sky. And on the days that they are crystal clear and blue, it's only a matter of time before these trails start coming overhead. Now, that's a big responsibility. Maybe you didn't come to this meeting thinking, oh my gosh, I must resolve the problem of chemtrails firing in the sky. It's a little above what I signed on for. I get it. But here's the good news. I represent a small group of people who have been discussing this for a long time. We are all comrades here. In fact, you could raise your hand if you came here with that topic on your mind or in your heart at all about these chemtrails in the sky. None of us consider ourselves anything like conspiracy theorists. We're just concerned citizens. The good news is for your commission is that we didn't come here today to complain about the chemtrails. We came here to team up with you in order to see if we can get our arms around something before it comes completely unmanageable. There are those of us who have privately, let me go back.
Are you asking that you think that should be something that Panhandle Health addresses in the environmental aspect of what they're saying?
Absolutely.
As a talking point?
Absolutely.
Because I want to be clear, because what this setting is they're asking you for input on Panhandle Health. And so I want to make sure that message is clearly given, not just you're giving a comment about chemtrails, but you want to see Panhandle Health's viewpoint
Well-
on this topic as a discussion point when it looks to its future topics.
That's
Is
a
that
fair-
accurate?
Yes, and that's a very fair thing. If I could just, did you want to say something? Can I just finish it up with what I, real quickly? Is, if you were to reach out to the community, they will have, you're going to need empirical evidence. You're going to need, soil surveys, conversation with beekeepers, conversation stuff, all that stuff. I don't mean is available. In fact, it's somewhat abundantly available. Individual citizens has hired their own soil samples and stuff. It's organized. And of course, we'll need to work together. But the idea is this. What my ask is this. As a reaching out to you guys, the goal would be to follow in the footsteps of other states. There's huge precedents. Tennessee has banned geoengineering in its state. I, as a matter of fact, have an ongoing email correspondence with the office of Senator Steve Sutherland of Tennessee, who has generously shared emails with tons of links and tons of information about how that state managed to get it banned. I believe that the strategy for Idaho begins in this room. When the Panhandle Health District acknowledges that the dangers of chemtrails are real and imminent, that becomes legitimate. It's way more important that you say that than that I say that. If the health district then writes a strong letter to our mayors, our governor, and takes action, what we're trying to do is seed something like chain reaction. Talk to Moscow, Coeur d'Alene, and eventually reach the capital of Boise and say, this state believes that there is nonsense going on, and it could be larger than what none of us can do that alone. Obviously, what I'm talking about is much larger, but this is a health crisis. And I guess what makes me a bit nervous about it is that what we are talking about is a matter of legacy and stewardship. Are we going to sit by and wonder what happened to our blue skies, or are we going to take a legitimate action saying this is a health crisis looming, and what better place to start than with this district here?
Okay, Dr.
Thanks for
Fletcher,
giving me
what's your response on that? And can you pass that microphone back to
Yes.
the gentleman there, Dr. Fletcher?
Okay, I've given thought to this topic of the chemtrails, and you are absolutely correct. To pay attention to our environment from assaults, from toxins, environmental toxins, would lie within the core portfolio of the management of the commons. That's what you're driving at. I get it. I am your ally. Now remember, I take my marching orders from these guys right here. And now, the only thing I could do to perhaps accelerate it is our strategic planning meeting is in May. If you want something done before then contact all 15 commissioners of the 5 counties and tell them that there's urgency here and you want immediate action. Now, let's go to Tennessee. As best I know, Tennessee is the first state to, if you will, outlaw chemtrails. And there are 7 other states in the union that have legislation in their state assemblies looking to do the same. But to the best of my knowledge, just because a state outlaws it doesn't mean they aren't a flyover state, and those airplanes at 35,000 feet are flying right over Tennessee and dropping all that stuff. In that connection, I did read one report that soil samples were harvested in far western North Carolina, where that Hurricane Helene dumped 100 inches of water, and there were sky-high levels of heavy metals and silicates in the soil, many times higher than would be the background concentration. Now, where in the hell did these elements come from? One wonders. So I think that it behooves us to give thought to monitoring. Now, there's nothing that Panhandle Health can do. Nay, there's nothing that even Brad Little can do to outlaw whatever the hell the overlords are doing to us. I don't know. We can't outlaw it. But what we can do is monitor. And with monitoring, we are now empowered. We have information. It's not just a conspiracy theory. So I would be on board with monitoring. And by the way, while we're at it, that wouldn't be the only thing I would monitor. What about the organic food that you're told doesn't have peel or glyphosates? You pay 2x or 3x more money to go to Winter Ridge or Pilgrims to buy that expensive organic food. Has it ever crossed your mind, is it truly organic? I can tell you, I used to buy grain for my animals, my cows and pigs and whatnot, and I was told that this was a pristine product. No, we tested it for glyphosates and they were sky high. So until you actually measure something and monitor it, you really don't know. So again, management of the commons. You see where I'm going with this theme. These sorts of activities would be within the portfolio of true public health. You can't control whether glyphosates are on some food product, but what you can do is know whether that given food product has it, and then you can choose either to buy it or not.
So Dr. Fletcher, are you seeing an opportunity for Panhandle Health to address, for example, by comparison, when you look at our food source, since you mentioned nutritional, the amount of artificial and other stuff, the bioengineering of food that's sold in our area that doesn't come labeled? Are you saying that Panhandle Health would have that within its scope to address making sure that our community has that information on products in our area? When you talk about monitoring, what does that look like?
The short answer is yes. I see no reason why we can't. The only limitation, there are two limitations: permission from you and money. There's no reason we can't. Here's one. There was a bill I tried to get introduced into the state legislature, and that was to label food products that had been exposed to the mRNA vaccines. So for instance, the chicken industry had the chickens, commercial chickens, exposed to mRNA vaccines since 2012, and the pig industry since 2018. So that pork loin you just consumed may well have had prions in it as the byproduct of contamination from the mRNA vaccines. So yeah, well, I couldn't get it. I mean, Big Pharma killed that bill in Boise. They wanted nothing to do with it. Same thing, you know, the Bayer bill that would have outlawed glyphosate in this state. That was a problem. In fact, Scott Herndon lost his election because, to go back to the Senate, because he was one of the few voices that was looking to outlaw glyphosate. And the people with a lot of money, deep pockets, went after him. I'm not saying that's the only reason. There are all kinds of things, but a little background. But as it happens, and Eric mentioned this, the way the state legislature structured the health districts affords us some measure of sovereignty. We actually can pursue our own programs here. We don't have to ask Mother May I of the CDC. We don't have to ask Mother May I to Brad Little. But I do have to ask Mother May I to these guys. But they're local and we see them. They're not abstract concepts in Washington, D.C. They actually sit here and they take notes and they give a shit. You follow what I'm saying? Now we need money. If we're going to have monitoring programs, we're going to have to contract with some analytic labs. These are going to be, real projects. I mean, and we have to have, there are a lot of methodologies that we have to deal with. If you're going to sample soil, water, air, you have to have a well-defined chain of custody. In other words, when you sample it, you have to have certain methodologies in place. And then once you've captured your sample, it has to be labeled, dated, everything else. There has to be a known, objective, identifiable, reproducible chain of custody. And then you can publish your results. So I think it's definitely something we can do. I think it's in the portfolio of what's accomplishable. It's just that we need the political will and some money. Did I answer your question, Commissioner Williams?
You did. You guys are going to make me travel.
Whoa, whoa, whoa.
Oh, I don't mean to.
Yeah, that's fine. I think that gentleman was gonna go.
Oh, I didn't.
Well, I just wanted to say just briefly that I just remind you that you are also sitting on a task force waiting to help. There's people here right now ready to join the team. I would pay for my own soil sample. I know they're about $200 that I would gladly pay. We would come up with exactly what we're looking for, what the protocol is. And I'm not the only one to say that. I could think of 15 people right now who would say, I would love to. So I remind this panel, as you're sitting on your task force, ready to help you with glyphosate
I'm there.
issues with that.
Tell you what, what do they call those, monkey survey? What are those, instruments? You send it out, you get okay, so Commissioner Corn here is an organizer. And this afternoon, he's going to set up a monkey survey with his other 14 compatriots from the 5 county regions. And he's going to say, you know, we held a town hall in Bonner County, and there seems to be some excitement about developing a air, soil, water sampling project. Are you on board, other commissioners, to authorize Panhandle Health to investigate this as an activity to launch immediately?
Commissioner Corn won't call it a monkey survey, we'll call it survey monkey.
6.5 dozen the other.
Okay, does that, I mean, I'm ready to, and Eric and I have talked about this. I know for a fact. See, Eric, the beauty of Eric has several beauties, but one of them is he actually gives a shit. He really does. His predecessor, not so, but this guy is the real deal. The other nice thing about Eric is that his forte, his core competency is actually DEQ, environmental. So when you speak, I mean, this is music to his ear. He wants this. This is his strong point, and we've talked about it. But we can't just do it in a vacuum. You can't say, okay, Dr. Fletcher, go and start this program. No, we have to get authorization. We're going to have to develop the methodologies. We are more than happy to work in partnership with you. More than happy.
Hey, Dr. Fletcher, I had a question just to clarify if I understand correctly. So you were saying with Medicaid expansion, that allowed anybody in the state of Idaho to access any health services through doctors and hospitals and whatnot. And so that's almost a duplication of services that's currently being offered by Panhandle Health. Was that correct?
Exactly. That's exactly correct. As a matter of fact, and I'm going to ask Eric to weigh in on this. I think there's one of the 7 health districts has already completely disbanded clinical services because the utilization of those services had essentially evaporated. And indeed, we are experiencing the same. Eric, please.
What I will say is, and this again is a bit out of my wheelhouse, but I do believe certainly Medicaid was expanded and captured another contingent of the population, but there is still a portion of the population that doesn't qualify for Medicaid, and they also do not have their own commercial insurance. So there still is a subset of the population that does need these services. There are the health district does have a population that comes to them. There are federally qualified health centers like Connexu Clinic and Heritage Health that are also providing services to these individuals. So there is still a need. I don't want to say that we're duplicating services. There is a population that does need these services, but it has diminished since the expansion of Medicaid.
What's the percentage of, if the denominator is all healthcare services, what percent are rendered by Panhandle Health clinics?
I would not know that off the top of my head.
I don't either, but as I walk into the clinics and there's no one there, I would surmise that it's way less than 1%. So the subset population you're talking about that's in this wrinkle that they're poor, but not sufficiently poor to qualify for Medicaid is a very, very tiny subset of the population.
So what I want to point out here is you've got about 40 minutes left and you've got a lot of people wanting questions. So we're gonna go to Dr. I gotta go there first.
It's all right.
Doctor.
It's your turn, Tom.
Let me get this microphone out of my hand before I, Alice. What I wanted to ask made more sense before Matt made his very important remarks. Thank you, by the way, for the clarity that you brought to the whole topic. I'm wanting to know if we can at some point draw a clear line between the commons, as you differentiated, and the individual, our responsibility. That's why I came to the meeting, was that I thought that I read an urgency for a redefinition, a clarification of individual responsibility versus the commons.
Okay, so I can tell you what Thomas Fletcher thinks, but that's almost irrelevant. What matters is what the commissioners think, because I take my marching orders from them. Let's use this example of the clinics. Let's say that the 15 commissioners go, you know, we really do need to keep the clinics open. We feel this is the feedback we get. Well, you want to know something? I'm going to keep the clinics open. I'm not going to close them. So when you ask for clarification between public health and private health, that is the question. But I can only give you my private answer. I cannot tell you what Panhandle Health will do, because that really comes from their authority.
It's going to shift as we dialogue, public and.
That's right. And over the next several months, it will. And you keep calling them. Let them hear from you.
Okay. First thing I want to say is what you're describing here, this town hall, this is actual leadership instead of followership. And I'm purely delighted about it. It's a real breath of fresh air, if I may say so. And what I think I keep hearing from everybody that's interacting with you is that what we want is to be informed about threats to the common. And we want to be have a way to report what we perceive as threats to the common. Let me give you an example. This summer, there were a bunch of dead fish in the lake. A number of people I know were talking about those dead fish. I didn't know what to do, what was causing it, where to report it, who would look into it. I think it would be awesome to know that who do I call to talk about that, find out what's going on. So to report and inform, to me, would be the greatest service to the commons.
Duly
Not a
noted.
question there.
Right here, behind you.
I actually have a few things here. Just so it's clear, this is a global
Could you
issue.
please state your name, please?
Oh, I'm sorry, Margie Broderick.
Thank you.
It is a global issue. I've been following this too quite closely.
You're talking about the
the
atmosphere?
chemtrails,
Oh, yeah,
yes.
no question.
And more recently, people noticing the fog.
Right.
And there's so many respiratory issues now, little children having double pneumonia. Also, I think it's important to bring fish and wildlife into this. We live on 5.5 acres. I've noticed less migratory birds, bees, no bees. I think I counted
Yeah.
one.
Bee
Bugs,
colony collapse is real.
different kinds of bugs are just non-existent anymore. And it affects the whole food chain. Our trees are dying. There's big chunks of pine trees, the needles falling. That is not normal.
You
Also-
appreciate everything you're articulating relates to management of the commons.
Yes,
Whether you get a vaccine or not is not commons. The forest is commons.
but I think that there is a blurring line occurring. I'm just going to say it. I think that people are getting ill and they're not sure where it's coming from because there are so many things going on.
Well, Robert Kennedy would argue, and he's not the only one, but he's the leading exponent. We are assaulted by a
Yes.
host of environmental toxins, a host of them. They're in our food system.
Right.
They're in our pharmacology, forever chemicals. They're in our clothing. All of those perfluorocarbons that that make up your Gore-Tex and whatnot. That stuff's going into your brain, your underarm deodorant. I mean, the assault, the chemical assaults on our bodies are phenomenal, and it is altering our consciousness. I mean, literally, we're stupider now than we were a century ago.
But there are a lot of healthcare professionals, and I'll tell you, this area is a hotbed of healthcare professionals that are addressing this. It's not in the normal realm of traditional medicine, and they are having success. People feel like they can step into the light and talk about detoxification and different therapies that are helping. And that really needs to come to the forefront. It just kills me to be on chats or threads and see people saying they're suffering from this and that. And I'm just screaming, thinking there are some solutions that people can try. And we do need to just hammer it about these chemtrails. It's what brought it to my attention was seeing them more often. And I was talking to a fellow that works for North Idaho Propane. He said, oh yeah, they've been going on 10 years. And I said, maybe down where you live, closer to Coeur d'Alene, but I just started noticing them more in the Sandpoint area. And I would go outside in the morning and I would feel sick to my stomach. You could smell it in the air. And there are a lot of healthcare professionals that are doing more in-depth testing, and they know what's going on in people's blood, or those are the people that need to be at these meetings too. I mean, we can't
It's an open meeting. There's
all of this.
one of them sitting in
quiet.
the corner back there. He's a good friend of mine.
What their question here for us is, what is the direction that you want to see Panhandle Health go? We have a lot of topics being discussed, but they need marching orders, okay? That's what they're looking for. And so what I hear is people want us to be informed and participating in active discussion on the chemtrails over our area. Okay, is that summarizing what you're saying now, is you want? us to-
Yes. Yes, because well, what you said, RFK Jr., I heard him say chemtrails he's addressing. So that's promising that it's not being hidden. And then also, I haven't followed up with him, but I did talk to Fulcher's deputy director in his Coeur d'Alene office when I first was seeing how bad the chemtrails were. He was calling it contrails, thinking it was a jet. And I said, no, this is something that's going on globally. He was very interested in knowing more about it. So
This is what you want.
thank you very much for everything you're doing and also bringing Christianity into this.
Thank you.
I appreciate it.
You're welcome.
Dee Dee Fletcher for the record. First of all, I just want to say that I am so excited to see this turnout. I am so excited that so many of our community care about each other. I think it's a wonderful thing, and I'm just want to add one request, and that would be on the org chart that the public is actually in charge and we elect our commissioners. We love them because they listen to us. So I think I think we got to add us on that board.
Thank you.
Up front and then.
Thank you. My name is Ronna Snyder, and I'm a co-admin for the group that some of us have alluded to. It's called, it's a Facebook group. For those of you who hate it, I do too. I totally hate it. But it is a private Facebook group, and it allows a community to form. And in, I would say, mid-April of this year, a couple of women whom I don't even know just had a vision for having talks like this. And it started there. And the membership skyrocketed, and it's called Ban Geoengineering and Weather Manipulation in Idaho. Anybody can join it. You hit the join button. Just say you live in Idaho and you're not a serial killer and we'll let you in. So that group, ban geoengineering, weather manipulation in Idaho. We have 2,200 members that are residents of Idaho.
So for those of you that are here with groups, if you want to hang out and let people get your contact information, but I want to, because at some point you guys are also going to want to hear what your commissioners have to say about this topic, because some of what Dr. Fletcher is saying is he's pushing it to commissioners to kind of give some direction. But I want to make sure we answer some of their questions, because they're asking you, the people, what do you want to see from them? And this is one of the few times that we have them here to hear from us.
So you're on the docket. We're gonna listen to you.
Now,
No. We,
just let me out of the
you're
gate.
talking.
Not in this meeting. This meeting is specific to what does Bonner County want from you? I know, but I gotta keep it to where we're going. We already got your topic is what you want us to address Panhandle Health.
Okay.
But we need to hear what else, because chemtrails isn't it. It's important, but that's not the only thing.
Can I show one graphic?
I want you to do your
$15
No,
graphic?
you can do that after we're done.
I'll stay.
We're,
I'll stay as long
we
as
are
you
here for Panhandle Health direction from the community.
Okay,
All right.
thank you so much.
Yes, Jan.
On the subject of that little wrinkle where people are lost between not having enough money to qualify, but not having enough money to pay for. I know the challenge is always, how do you let those people know? So maybe focusing on how do you get the word out there? We all face that challenge with whatever business or group or whatever we're trying to promote. When regarding whether it's chemtrails or any other subject, in speaking with, I'm sorry, is it Kyle? Eric, I'm sorry, Eric. You mentioned that you had tried to present some legislation. So if you can spearhead with the help of whomever in the group is able to, write legislation, prepare legislation that has the force of Panhandle Health behind it. If that's possible, that would be really great on whatever subject.
Well, the particular piece of legislation I was referring to was actually sabotaged by the executive committee of the 7 health districts.
Right. We just need to keep trying.
Well, I think there's a sea change. Remember, one of the first remarks I made is healthcare in this country is in a very different place than it was even 2 years ago, and certainly 4 years ago. So stay tuned. Don't give up hope. I think we can have promise of, well, I'll tell you one. So I sometimes communicate with our elected officials, and I sent out to all the elected officials Dennis Rancourt's analysis on all-cause mortality globally, which was the most thorough examination of the consequences of the vaccine program on human society. It was 500 plus pages, the most authoritative, documented epidemiological work. Of all the elected officials in this whole area, I only heard from one, Jim Woodward. He said, "Thank you for sending it to me. This is important." So, and he's the new guy. So, yeah, we have to keep pushing. Okay. I agree with you. We have to keep pushing. I'm not going to give up. I can tell you that.
It's not all on your shoulders. I believe this woman is saying, if someone could let us know before the fact, so that we don't hear about the failure, that we're on board while there's still a chance to act and push these things through.
Are you looking
If
for,
there
do you
is-
want to write legislation? Is that what you're looking to do?
We would just like to know what's before these boards, what's before these legislators. What are they facing? What challenges would they like to hear the public speak in support of? We would like to know while there's a chance to affect these things, not after the fact.
How can the
After they
public
fail.
I
support?
think therein is the challenge of, like I spoke about, that wrinkle of people letting them know. It's difficult to get the word out to people. We all want our privacy. We all go about our daily lives. This isn't top of our list to do, but we realize that without civic involvement, we're going to be ruled by a master. So finding a way to get that information to people
We have a question back here.
I stepped out of the room, so I don't know if this question has been asked. Feel free to tell me if it was. As a former teacher and daycare worker, I would love to know if there's a way for the board to sort of update how the health clinics in the area have vaccine information. I'm really glad that parents have the option to immunize, have their children immunized or not immunized, but there is a bunch of updated information out there on the efficacy and side effects of these vaccines that I believe are not being presented. I've heard that it's often on this like little packet inside the box, and it's not necessarily really out there for parents to see. And I know that most people don't read fine print. So I would love to know if there's a mechanism that the board can use to basically update and make more available vaccine side effects, what vaccines do, et cetera. One
Okay.
example would be the tetanus vaccine, which is often recommended to parents after their child receives some sort of puncture or bite wound. That's actually would typically take too long to take effect if there really was tetanus involved in the injury. That would be one example of updated information. I would love to know if there's something the board can do to put that out there.
Okay, thank you for asking that question. So, of course, you know, the elephant in the room for public health in the last 5 years or 4 years anyway, has been the COVID vaccine. I mean, let's just face it. We didn't even know what public health was until all this COVID pandemic chaos. I didn't. I never gave it second thought. I just thought it was poop management, never gave it any other thought. And then, of course, our entire worlds were turned upside down. So the elephant in the room is, of course, the COVID vaccine. And then by extension, well, gee, how many of the other vaccines are problematic? So towards that end, 19 countries on planet Earth now have banned the COVID vaccine. In fact, they've banned the mRNA platform. 19 countries, to include some like Ireland, Belgium. I mean, not insignificant countries. The state of not California, Lord, what Freud, Sigmund Freud, where are you when I need you? The state of Florida, Joseph Ladapo, outlawed the mRNA vaccine 6 months ago, 9 months ago, on the basis of the contamination of the vaccinal juice with DNA. And that we didn't know what the consequences of that DNA contamination would be to human health. Health District 3 here in Idaho, they happen to have Ryan Cole and the Attorney General as board members, Raul Labrador, and they outlawed the COVID vaccine. We were encouraged up here in Health District 1 to do the same. I resisted, and I'm choosing deliberately a completely different strategy here. Rather than micromanaging which vaccines are good and which vaccines are bad, what we're going to do, and we in fact have bylaws changes that are going to affect this, we are going to add additional information to the informed consent protocol. So when you come into a clinic to ask for a COVID vaccine or a RSV vaccine or whatever vaccine, you're going to get one sheet of paper that is the material that the CDC officially publishes. So there's your first piece of paper, and it says safe and effective. Then you're going to get another sheet of paper that's going to be generated by the Panhandle Health Board. Read Thomas Fletcher and his compatriots. And that additional piece of information, and there will be transparency and complete, openness. We'll say this sheet of piece of paper is what the federal government wants you to know, and this sheet of paper is what your local board members want you to know. So, for instance, if we're going to talk about the COVID vaccine, we will let them know that there's DNA contamination. 7 different laboratories all over the United States, all over the world, have identified DNA contamination. The most recent, by the way, was published 1 week ago, a collection of enterprising high school students engaged in a science fair project under the direction of the FDA, and they identified DNA contamination anywhere from 7 to 500 times the upper limit of what is permissible, not percent, that's times. So this information like that, and Dennis Rancourt's information, his epidemiological work on all-cause mortality, these sorts of pieces of information will be included on the separate piece of paper. Patient comes in and says, I want my COVID vaccine. Fine. Here are 2 pieces of paper. And by the way, we want you to sign at the bottom of the piece of paper that you've read them. Okay, my body, my choice. You want the vaccine? Have it. I will not deny you any vaccine you want.
So Dr. Fletcher, can we go to Roger? And then I want to make sure the board has an opportunity to respond to some of the things that the people have said, because some of your stuff hinges and we've got 30 minutes left, but Roger has the microphone next here.
Quick question.
You're good. I handed it to you on. Did you touch it after I gave it to you?
Quick question.
There you go.
Looking at the chart, the hierarchy chart, it showed that the Board of County Commissioners for our 5 counties involved in Panhandle Health District give the marching orders to the Board of Panhandle Health, and then he executes the day-to-day operations of it. But a second ago, you mentioned that you had sponsored legislation that went out. Did that go out from you personally? Because you said an executive commission somewhere up here overrode what you did and jumbled up what you wanted to sponsor. So can we sponsor a resolution or draft legislation as the Panhandle Health District straight to the legislature? Or does it have to go through anybody else?
No, you can communicate
Not
directly.
me, Panhandle Health.
Oh, I don't know. I have a little bit of misgivings. I don't mind talking to Cornell Razor or Jim Woodward. I know these people; they're good people. But if I were to go to Cornell and say, Cornell, on behalf of Panhandle Health, I want you to carry the following piece of legislation, I would have some misgivings about that. I mean, I certainly wouldn't do it without their permission. But I don't think that's the role of Panhandle Health, quite frankly.
Okay, a minute ago, you said you had legislation that you were going to send up that had something to do with vaccines. And you said an executive commission jumbled up the way that it was written, so it got lost.
Oh, it
in the
had to do with
sauce.
labeling. It was the Missouri bill. It was labeling food that had been in contact with mRNA vaccinations.
Okay.
It was a labeling bill. This was 2 years ago, 3 years ago.
I think Roger's asking you, who is that executive committee?
Correct.
Oh, the
Over the-
trustees, okay.
Over the district.
Okay, now I know what you're talking
And
about.
what is their authority and power over?
Well,
They-
they shut it down. They have no authority or power.
He's wanting to know who the they are.
Okay, I'll tell you. The 7 health districts elect a representative to be a trustee that sits on, if you will, a committee of that organizes thoughts and activities of all and coordinates activities of all 7 of the health districts. They're called trustees. Now, they had an emergency meeting that gathered to deal with the topic of this labeling bill, that we were going to force food producers to label any food products that had been in contact with mRNA vaccines of any kind. Okay. Now, Farm Bureau got involved. Health districts got involved. All kinds of organizations got involved and shut that legislation down. Big Agri got involved. So the lobbyists in Boise went into overdrive to kill that labeling bill, just as they had done. I had spoken with the legislator in Missouri who sponsored the bill there, the labeling bill there. And I said, what killed this bill? And he said, Big Agri, the lobbyists, they killed it. So you have to overcome a lot of money and a lot of power and influence. Now, as chairman of Panhandle Health Board, I would have misgivings about advancing legislation. I can go to Cornell as a private citizen and say, Cornell, I'm interested in a piece of legislation. Will you sponsor it? as I did with Sage Dixon and others. But I don't think it's appropriate for me as a chairman of Panhandle Health.
I think that a direct answer to what he's asking you though is that if Panhandle Health Board, through all of the mechanism that it has, were to come up with something that they wanted to be run in legislation, there is a avenue to do that. And it's, I think
There
what he
absolutely
kind of,
is.
distinguishes as a member, he wouldn't do it. But in terms of if the board had its interest of the top 5 northern counties and your commissioners wanted to move forward, they could be in a, he's wanting the name of Panhandle Health to go forward before the legislative body saying, as the top 5 northern counties, we are supporting a piece of legislation. Could the name of Panhandle Health be used? And the answer for that is yes, it could be.
Yes.
He's just saying he's not willing to do it on his own individually, but the board could vote with the approval of its commissioners that we want to run legislations. And you'll see that happen through like the Idaho Association of Counties. You have that issue comes together. The director of Panhandle Health flies down to our annual meeting, and that's where our intergovernmental affairs addresses legislations and things like that. I think that's what you're really asking him, is the process to get Panhandle Health's name on
Very
it.
close, but not specifically only to legislation. So when the whole masking thing came up with COVID, did the executive committee that you're talking about over
Right.
the 7 health districts, do
They're
they have
not
the
really
power?
over, by the way. They're coordinators. They don't have.
Yeah,
no
well,
authority.
Okay, so they
We-
couldn't tell the 7 health districts, if you guys don't agree to masking, you're not getting any money
They
for
do
this.
not have
contract.
that authority.
That's all I want.
But I want to go
Uh,
back, actually, what Commissioner
hang on a
Williams said
second,
is
Thomas.
actually very, very germane. The strategic planning meeting that we're going to have in May 10th, I have asked to facilitate that meeting a gentleman by the name of Seth Grigg, and he has agreed to facilitate it. Now, that is important because Seth Grigg is the executive director of the IAC, the Idaho Association of Counties. There is no single human being in this state who has a pulse of county level politics than Seth Grigg. And I've asked him to facilitate this meeting because I want him to appreciate and understand what is taking place at the grassroots level up here in the Panhandle of Idaho, because no one will be a better mouthpiece, if you will, someone who can facilitate the dissemination of, hey, what are those guys up there doing? What are they up to? And I would like for us to be a petri dish, kind of political experiment. Let's get some stuff going. And Seth Grigg, I think, would be a very appropriate human being to promulgate that message. So you're absolutely correct. That's the avenue. That's the way to do it, is
But
through the IAC.
It has to start with the people. And so I'm going to use this to kind of say where I see things going as a commissioner. And it starts with, as the people of Bonner County, you have to have a voice. And so one of the biggest things that happened in COVID is a perfect example. I'm also a nurse. I worked on the ground during COVID time, and the amount of politicizing of the event that made people make decisions that for some people, they thought they were making sound decisions based on objective medical evidence to support decisions made. And so during that period of time, if you worked on the floor, what you saw was chaos within that made people question, is this the right direction to go in healthcare? And then what you have is the voice of Panhandle Health is treated with a, do I trust you? Because people made decisions, and now the information that used to be deemed inappropriate information is coming out to be accurate. So how do we move forward? So as a commissioner, for me, one of the number one things is, if we're in that situation again, how do we trust the information that comes out of Panhandle Health for the people of Bonner County? Because we're not worried about the people of another county, even the other top 5. It's Bonner County residents want to know, how do we trust that information? And it starts with how we are disseminating the information to the people of Bonner County and hearing what the people of Bonner County are seeing on the ground. I know when I was in nursing during COVID, my view of COVID was not the view of COVID that they showed on TV. And that was the same similar for a lot of healthcare workers. Some healthcare workers chose COVID vaccine. A lot of healthcare workers said no. And then you saw a direction of, you're going to lose your job if you don't. And then you had the pull of people that are on the ground saying, wait, I'm not following some processes in medicine. For what reason? And it becomes political. So how do we as a community remove that political thing that gives the distrust of our medical professionals, our scientists, and then the district, so that when you bring me as Panhandle Health information as a commissioner, I know I'm making a decision based on objective, honest information, not a political movement. That's a difficult thing to answer. And that's a huge one that we have to keep coming together for, to know how do we proceed, because another event is coming our direction. The other thing that I would like to see is, and I'll tell a little bit of my story, is I'm a person who has significant respiratory stuff, and I did not get vaccinated. But then what happened in our healthcare is the non-vaccinated have been denied certain types of care if you're not vaccinated. What do we do as a health district to address that group of people that is negatively impacted and still negatively impacted by the decisions that came from the top down, even as an area that didn't force vaccinations? And so how do we positively impact our medical base for our people is huge, and it's not a individual effort. If you had a respiratory disease and you watched COVID, the negative impact of what you couldn't do. I have lived on a nebulizer. Who in the world would have thought someone's treatment was you cannot use your nebulizer because COVID existed? And that did not make logical sense to me as a patient or as a nurse. But did we do that? We did. How do I get the trust back as a medical provider, as Panhandle Health, of a community when we went through that phase? That's a hard one. And I think that's where the collective mind in this room has to come together, because you're hearing the news of new events. But I think what's really missing is, how do you, the people, communicate your issues that you see in your micro communities to the greater community, so that we can come with solutions, and not just the story of what we're hearing, but how do we change it so that the information gets there? Because we're not it. Some of the things you guys are addressing, like with chemtrails, we need the state representatives involved, because it's not just a county commissioner thing. It is a state issue. And so when we're doing, like I do a thing in Spirit Valley for a town hall where I bring all elected officials in, they need to hear everything that we're saying, because when we send them to Boise, we need to know they're communicating our message from our area. I would also like to kind of shift a little bit of, nobody's brought up planning and zoning, which we have some members from our planning department here, is for me in Bonner County, we need to do a better job of hearing some of the concerns on our water and our soil. Rathdrum Prairie Aquifer we talk about, but we don't see any damage to the aquifer now, but we're building at a rate that exceeds what their recommendation is. So how do we protect that before it becomes a problem? Because once we recognize the problem, can we fix it? Or do we just say we're going to add some treatment to the water that we messed up? Those are the kinds of things that we have to have a true plan for, utilizing people in our community that have done their independent research that can come forward. So that's what I would like to see, as a, not just an update of this is how we spent your money, but these are our concerns from our community, and how do we move forward so that we're pushing not the conversation, but the issue to effectuate a different outcome. Because we don't just want to talk about chemtrails and water. We want to say we've positively improved that. We've made an impact in our soil and water.
Well, your last
So-
point, I think, is very strong. And actually, you know, we talked about management of the commons. There you go. You just heard it. I'm going to volunteer the director. He's got a smile on his face. I think this man right here, it happens to be his core competency. But I think, Eric, are you on board that you meet with planning and
tell you,
zoning and have
he
some
has.
conversations?
He has, in terms of DEQ, because I've sat with Eric a few times, and so has Catherine. The question comes down to, how much compliance do you see from the people that Panhandle Health is talking to in those areas? Because, for example, in our planning, they tell us we can't determine the viability of your septic systems if we don't do test holes. Bonner County has not shifted in a direction that says we should do test holes so that we can make sure we're doing right by our water and soil and all the stuff that is management of that lovely stuff that we flush. We do not in Bonner County limit the footprint over the Rathdrum Prairie Aquifer like Kootenai County does, for example. They have a 5-acre minimum over the Rathdrum Prairie Aquifer. We don't do that. And so when we do the test of recharge, we say, well, it's flowing good. Well, we haven't been building this much such that we would see a negative outcome of what we're doing. That's going to happen years down the line. So there was a reason someone said 5 acres. Bonner County does not adhere to 5 acres. So are we creating our own problem by not doing something that accepts the information? Because I've met with Eric quite a few times on the Rathdrum Prairie Aquifer of what we should do. And that's where being in the room where the people say, well, Bonner County, why aren't you guys doing that? That's what it takes, is the people's voice. And I see Mrs. Fletcher's hand is up there, back there. She's gonna scream real loud because I'm not back there with a microphone though.
This is a topic that we have not, I don't think, brought up. But I'd like to talk about, what about the Washington State Hanford nuclear waste that's being transported across the panhandle of Idaho via train, and it's going to Utah and Texas. So anybody remember Flint, Michigan? And I just think that that waste should be dealt with in Washington. I don't want it spewed across the panhandle of Idaho. And I'd like for us to talk about that.
Eric, are you gonna talk about the transcontinental development of?
Yeah, this is right up his alley.
Major transport route for all kinds of waste. We have major train routes that go through Idaho to Canada and to other parts of the country that are carrying
A little closer to the mic.
waste of petroleum products.
Thank you, Roger. He's taking
So
my
it's
spot.
I guess I'll just summarize. It is a significant issue. There are questions of jurisdiction on what we have authority and in some cases, there are federal overriding commerce statutes that even the state of Idaho cannot influence. But these are significant concerns, especially when we start talking about aging infrastructure and the pipelines that crisscross our area.
So how do we bring her topic to the forefront, that it remains a topic of conversation to address? What do we do in the event of a derailment with those chemicals in the panhandle?
I would say we do have an emergency preparedness section, and I think it would be appropriate to have a plan in place on how we're going to address and minimize in the event of that situation.
So Mrs. Fletcher, what we'll do is we have our local emergency planning meetings once a month. And so I will ask Bob to place that on a discussion topic for that item coming through, so that as not just, we do have this topic, but so that there's more community awareness, and maybe we can get a presentation from the railroad who's actually bringing it forward, because they do talk to us about their emergency plan and what that does look like. But when you're talking about that level of chemical, people want, it's not just when it derails, it's what happens when it spills into our water source and what's that outcome. So I'll ask that we get that as a meeting, and then I'll make sure to message you guys on that. Another topic for Bonner County is we are the per capita highest, top 5 northern counties for suicide. So I'll first thank Panhandle Health, because I sit on our behavioral health board, but that is huge. We rival Kootenai County per capita. We are, I believe, over 18 at this point. Our community being more aware of those issues and the poor mental health services that we do have in this area is significant, because we have seen an increase in this year. We hit more than what our typical average was in the first 6 months of 2024. And so that's huge. The trend is there for Bonner County, but that remains a Panhandle Health resource. So we're pushing education on suicide prevention in our schools, but that's another Panhandle Health one. They have absolutely free resources for families. With one of the focuses that I've talked with Valerie about is our area wants faith-based focused counseling available, because a lot of what you see in the realm of Panhandle Health lends towards an ideology that Bonner County residents don't largely accept. And so they have been working on the faith-based aspect of mental health. Commissioner Bradshaw.
Yeah, I just wanted to throw something in there. Dr. Fletcher can remember back. He wasn't on the board
not
at
muted.
Panhandle Health District when COVID all
Commissioner
started.
Bradshaw.
Yeah, can you hear me?
Steve.
Yeah,
He's trying to speak when he lights up green. So maybe your microphone's not on your end, on your computer.
can you hear me now? Let's see.
Sure, go ahead.
Well, I mean,
Does Medicaid expansion or Medicaid at all cover mental health treatment or help, that sort of thing?
It does. The problem is availability of service. That is the problem in a lot of the country, but in Idaho specifically, it is availability of service. Steve, if you can hear me, I'm gonna dial your phone number on my phone because something's not working there. Did you have
Okay.
something else, Kristen?
When you say availability of service, you mean there aren't enough providers?
Correct. There's a lack of service availability in our panhandle in general, but it's across the country. A lack of,
How would Panhandle Health District contribute to increasing the service, availability? How would that factor in?
so one of the things that we've looked at on the board is like telehealth so that you can go beyond just your local area. And so some areas actually have not just therapy visits that are available, but the psychiatry visits that are available through telehealth. But for example, in 2025, a lot of insurance dropped the telehealth in our area. You see that, for example, in California has a lot more telehealth. So then their providers can just be licensed and farther apart. So looking at novel ways. And then in our area also, one of the things we do is look to people that are providing services, like we have the clubhouse that's opened in Sandpoint, and getting that information out to the community so that they know where you can have some breaks. There's also some family groups, and Panhandle does host and help pull those resources in, and then pushing those resources into the community so that people are aware of what is available. And some of the availability is people that are struggling with the same similar issue that come together to be a support group. Let me grab Commissioner Bradshaw here and see if he answers this, and then we'll go to you, sir. Commissioner Bradshaw, that's better.
Okay, when COVID all started, Dr.
District at the time. And
He's here.
he came on board a year and a half, but he provided information all the way down to the cellular level, the splitting of the genes themselves, the whole 9 mile. There was one elected official that followed that, went to Boise with him, and was vocal about it. And the big hurdle for this board is going to be the 15 commissioners of District 1, because out of the 15, only one would speak out. And so Ron, Asia, you guys have to be the forefront of getting the other guys to actually get involved and speaking up on these things. So, I got 1 week left, and so ball's gonna be in y'all's court. And so it doesn't define what a person says doesn't define them. What they do defines them.
Okay. Anything else, Dark? I hate to hang up on you, but I think I lost you.
Okay, that's not.
Oh, you're back now. Anything else?
No, that's it.
All right, I'll hang up
Please.
now then. Thank you.
Commissioner Williams, if you don't mind making a comment in regards to that. I appreciate Steve's endorsement there, but I don't think that his statements reflect the current state of mind. Eric and I have been all over the 5 counties. I got to tell you, there has been, I've used this term before, I'm going to use it again, a sea change in the way people are thinking about health in America. So for Steve to say, oh, well, come on, Asia and Ron, you better step up to the table. They've stepped up. I mean, you don't have to worry about these 2 guys. And Brian Domke, I've spoken with Brian enough. He's on board. I think you're going to find an overwhelming support by your commissioners. I think so. Eric, would you agree with that?
I would say that.
I mean, have we met resistance anywhere we've gone? Not really. I mean, one told me, Dr. Fletcher, you need to be a little less political. Okay, it's in my blood, but we have, We're gonna get there. I'm not even remotely worried about it.
So I want to let this gentleman go and then Wendy, because we've got 6 minutes left.
Yeah, Dr. Fletcher, I just want to thank you. First
Can you
of all,
state your name?
my name is Darren Purdy. And I just want to thank you for a really important topic, and that is this. People need to be informed. And the fact that you would inform for and against the COVID vaccination allows for self-governance. And that is the key to me. The problem is we don't have a lot of that. We have a one-sided slant. That's why you can go to the hospital, and if you didn't get your vaccine, well, we're not going to help you. That does not cater to an understanding that really they're supposed to cater to whoever comes in and needs help. But my understanding is that I think people ought to be more educated on the decisions that they make. I know we've encountered situations where doctors pretended like they were God, that we didn't know anything, and they didn't want to inform us at all on some of the things that they wanted to prescribe for us. So your emphasis on educating people on the decisions they make on the private side, I think is huge. I can't place an emphasis on that.
Wendy, go ahead and unmute yourself.
Okay, hello there. Okay, to bear with me, I'm under the weather and my voice doesn't have a lot of power behind it right today.
Us issue or?
It is an us issue. I can hear everybody online.
Okay.
I can see, I can hear them online, but for whatever reason, we're not getting it through to the.
Okay, so I will try to start with a question, as I know we're trying.
Is a meeting like this called to order? Was it yearly or is it?
Hello?
We have our meetings with Panhandle Health quarterly.
Quarterly, and one that's open to the public?
Every county meeting is open to the public unless it's executive session.
This
I think
particular
this
town hall,
particular type is new. The idea of a town hall with Panhandle Health in the meeting is new and clearly something that this community wants to see more regular.
So how often are they gonna be?
How often, that's going to be a question to the community, is how often do you want to have information on updates from Panhandle Health? Because this is how, part of what Eric is doing is we're looking at it in a way of rebranding of Panhandle Health, and what do the people of Bonner County want to see from Panhandle Health.
In response to that, I think if you have quarterly meetings that are open to the public, that should be sufficient, because public can make comment, I'm assuming, if it's open to the public. So that would essentially be.
Dan Rose made comments at our last one.
I think that the quarterly isn't a good example, only
It's an
because our
update.
quarterly meeting is an update of the financial aspect of
What the
Panhandle
fuck was
Health.
that?
That's not this kind of discussion, because I think what this community wants to see is, we want to hear an update of what's happening in our community. We want an update on, for example, the chemtrails, the vaccines, the medical provider availability.
Thank you for the
That's not the
clarification,
quarterly
yes.
meeting. And I think the question will be, could we add that to the quarterly meeting so that we don't have to have an additional meeting, but that we add a public interest aspect to that meeting for Bonner County?
Well, that's your call.
Well,
Commissioner Williams, if you want it.
I'm asking.
Yes, we want that.
Yeah, okay, well then she will make it happen.
Hey, Kristen Dodd. Real quick, earlier you mentioned something about, I think it was Southwest Health District, or one of the other districts that had banned or outlawed the COVID vaccine.
In their clinics.
Okay,
You can
I
still
just
get the
wanted
vaccine
to
at
clarify
CVS or
that,
Walgreens.
because obviously our health districts don't make laws. So I wanted to just, I know you know that, but how it came out. So there are people out there that think that Panhandle Health District, especially back during COVID, thought that they could issue out law mandates that we had to follow. So
for instance,
I think it's
this-
important to
Right, no, and
differentiate.
thank you for bringing that point up. For instance, this gentleman here brought up a good point about the health districts serving as a conduit to make available vaccines for a subset of the population that can't afford them, which is a good point. Let's say Panhandle Health was to pare back its clinical services. That doesn't mean, though, that we couldn't provide vouchers, vaccine vouchers. If you want a vaccine, you can't afford it, we give you a voucher, it's sort of like school vouchers or something, and you go to Walgreens and get the vaccine. And it won't cost you anything. Would that make you happy? I mean, it's a way in which we can still make it available at the public expense, but not have to run a whole clinic just to provide that one service.
All right, we are out of time here, but I'm just gonna summarize kind of our takeaways. One takeaway is we want Panhandle Health to add in chemtrails into their talking points. We want to have a quarterly, our Bonner County quarterly meeting be inclusive of topics that are specific to our community at that same time. And then we want to do a update on the Bonner County website that reflects the board meeting time with the Zoom link for the Panhandle Health Board meeting so that you guys can Zoom in and actively participate. And then on our calendar, we will add in the May strategic planning meeting so that you can also have access to the dates and times. And so with that, and then on, I'm going to use the local emergency planning to address the train coming through with the crap from Washington to see what our emergency plan is for that. Did I miss something about what our summary is of what our takeaways are? All right, and then the people that came from specific groups are gonna hang out.
The soil testing,
Soil testing what?
full on soil testing and your testing.
That's involved with the chemtrail.
Yeah, and then the people that came from specific groups that want to share their information will hang back and give that information to Panhandle Health and commissioners if you want that to take place. All right, with that, it is 3 o'clock and this meeting is adjourned.
Thank you. Job. All right.
Oh,